it clearly is, and I'm sorry Mr. Cassidy left because I really wanted to answer him, because what he's saying supposes that this is the federal monies that are available and that nothing more is available, and states are cutting because they have to cut, and kids in California, the Democratic governor cares about kids. You see, it's a philosophical difference. You know, we think that having big oil get tax breaks is not something that the federal government should continue to allow. We think that saying that defense spending can never be cut is not something that's plausible. We think the tax cuts for the wealthy are not fair. And so it's not a matter of us not caring about the debt or a matter of us forcing the states to make these tough decisions. We think that my friends on the other side of the aisle just prioritize, and their prioritizing is tax breaks for the wealthy are important, and tax breaks for big oil are important, and GE paying no taxes is fine, and defense can never be touched. Well, we think those things have to be adjusted. So there will ultimately be monies to close the deficit and also to fund these kinds of programs, which we know are very, very important. So, yes, if you have that philosophy that we're going to balance our budget on the backs of seniors, on the backs of children, on the backs of women, then fine. Then what you say is true. But we happen to think that that's not where the cuts should come from. Yes, there's got to be belt tightening. Yes, there has to be some kind of cuts, but not the kinds of cuts that my friends on the other side of the aisle want to see. So it's really a philosophical difference. There's nobody on this side of the aisle that thinks that we should do nothing about the budget deficit. And in fact, I'm going to yield to Mr. Weiner, but in fact, I want to remind my friends that during the years of President Bush, Republicans controlled both houses of the Congress for 6 years of the 8 years of the Bush administration. So if they really wanted to do things with the deficit, they really could have done it.
The gentleman from New York, Mr. Engel, is recognized for 5 minutes on the amendment.
Thank you, Mr. Chairman. The point I was trying to make to my good friend is that you look at cutting as the only way to be fiscally responsible. We think there needs to be cuts. There has to be cuts, but we don't think that's the only way to do it. If you give the states a smaller pot of money, of course they have no choice but to make these cuts. But we happen to think that there are some priorities, and we think that these programs for health care are the priorities. You know, when you go to the emergency room and you have people with shoulders and all the things that you describe, I mean, they're there because they don't have insurance. They're not insured. And that was one of the premises of the Affordable Health Care Act. We wanted to try to insure as many Americans as we possibly could, and the estimates are that we will insure 30 million more Americans under that bill. We don't want people to use the emergency rooms for those kinds of things.
Will the gentleman yield?
Let me just get my thought out, and then I'll be happy to yield. So we're saying that there's got to be more than just cutting, and it goes back to what I said before in terms of the philosophical, differences. You mentioned, somebody mentioned the Ryan bill. I just don't think that we should just get rid of Medicare and Medicaid and turn things into a voucher system or a block grant. You guys do. I mean, I don't think so. And I think there are other ways of tightening our belts, and there are other ways of doing it. And I agree that both parties have been negligent in the past with doing it, and now we cannot kick the can down the road, but not to fix it the way you guys want to fix it on the backs of people's health care, to say we're opposed to the health care bill that we passed and signed into law, but that gives 30 million more Americans coverage. We're opposed to it, and we're going to make burdens even more plentiful on the states. And there's no maneuverability. The only maneuverability is just to cut. That's your philosophy. I believe that health care should be cut and that people's services should be cut. We think there are other ways of saving money. So I'm disappointed that we're here today to mark up legislation that would repeal protections for our nation's most vulnerable who rely on Medicaid and CHIP for their health coverage. It seems that every week the majority is proposing legislation that seeks to undermine the social fabric of our nation. First, it was repealing the Affordable Health Care Act. Then it was tinkering with Medicare and our seniors' health in the budget. Now we're considering legislation that would yank health care away from children, seniors, and mothers of dependent children. When are these attacks really going to stop? Preliminary reports from CBO show that if H.R. 1683 is enacted, up to 300,000 additional people will be left without health insurance each year. So my amendment would preserve the eligibility standards for mothers of dependent children. My amendment protects women who have children under the age of 19 from the harms of this bill, exempting them from the repeal of the maintenance of effort for Medicaid and CHIP in the Recovery Act and the Affordable Care Act. It makes me sick to know that if this legislation passes as is, mothers could be dropped from Medicaid, even those at 40% of poverty or less, which is, by the way, where half the states are now. I just cannot support a bill that would support dropping mothers of dependent children from Medicaid. Currently, the only mothers who have guaranteed eligibility under Medicaid are those in the 60-day period after labor and delivery and who are 133% of the poverty line. But we all know that motherhood does not end with delivery or 60 days thereafter. And I think we can all agree that right now, just because you might fall above 133% of the poverty line doesn't mean that you have access to comprehensive, affordable health care. My amendment would help support the long-term health of not only of women, but also of their dependent children. Data shows that the children have better health outcomes if their mothers are in the same health plan that they are in. I would also argue that a mother who is healthier is critical to the overall health and success of her children and families. Healthy mothers are able to focus more attention on their children's health because they are not struggling with their own. In addition, allowing women access to affordable health care can set an example for children to be diligent about their health, which we all agree is an important lesson. The impact that mothers have on all of our lives is both physical and mental. We all know that a mother's impact is irreplaceable, and we must do all we can to ensure that our children do not bear the burden of caring for an ill mother because she cannot access insurance as a result of this legislation. Nor should we force financial burdens and stress on mothers because they cannot access affordable care. I must admit that lately I have questioned the majority's commitment to women's health. Just last week, we voted to eliminate all insurance coverage for women in need of health services and abortion services. Now we're marking up legislation that could result in eliminating insurance for low-income women who have children. This is just wrong. And I would like to remind my colleagues that this past weekend we celebrated Mother's Day. For me, it's a day to reflect on the memory of my mother. I know that I would not be where I am today without her love and care. I believe it's hypocritical for us to honor mothers on Sunday and take away their health insurance on Thursday. So I urge my colleagues to support this important amendment, and I yield the balance of my time.
So I just
yes, I yield to Mr. Pallone.
I just want to say, I know that I had the amendment on children, but